wonderful world, and welcome to today's video. I am going to be continuing with the infertility series, and today I'm going to be talking with you about blocked fallopian tubes, what they are, what some common symptoms that you can notice or signs and symptoms that present themselves when you have blocked fallopian tubes, as well as what your next steps should be if you are suspecting that you may have blocked fallopian tubes. Now, if this is your first time ever tuning into a video on my channel, I want to take the time to welcome you and thank you for clicking onto this video. My name is Kathleen. You can call me Kat. I upload videos here on this channel on Monday through Friday, and they focus on feminine health, wellness, nutrition, fitness, lifestyle, and just overall well-being. So if these are topics that you're interested in and that you want to learn more about, I encourage you to go ahead and hit that subscribe button and make sure you ring the notification bell so that you are notified of any and all videos that I upload here on this channel. So without further ado, let's go ahead and jump into today's topic. Before we dive in and start talking about what blocked fallopian tubes are, let's take a step backward and discuss exactly the roles or the responsibility that the fallopian tubes have in the fertilization process and how normal and healthy fallopian tubes are going to act in your body. So the fallopian tubes, in essence, connect the ovaries to the uterus. The fallopian tubes is what allows the egg to travel down to the uterus after it has been released from the ovaries. Now, the fertilization process itself occurs in the fallopian tubes. So what happens is the sperm travels up inside of the fallopian tube, it fertilizes that egg. That fertilized egg will then travel down the fallopian tube and implant itself onto the uterus, and that is when conception occurs. Now, when your fallopian tube becomes blocked due to scarring or adhesions, that means that one or both of the fallopian tubes are preventing or not allowing the egg to travel down through the fallopian tube and reach the uterus the way it is supposed to. And since that is not allowed to happen, or the fallopian tube is preventing the normal travel or the normal pathway of the egg to the uterus, it's also interfering with the fertilization process by preventing sperm from traveling into the fallopian tube to actually fertilize that egg. Now, when it comes to dealing with issues of having a blocked fallopian tube, some common causes are going to be due to having scarring or adhesions present that will lead to blockages occurring or damage occurring in the fallopian tubes or to the fallopian tubes. Now, underlying conditions that contribute to these scars and adhesions developing or blockages is going to be pelvic inflammatory disease, endometriosis, having a sexually transmitted infection, fibroids, a prior ectopic pregnancy, as well as past abdominal surgery. When it comes to blocked fallopian tubes, there are 3 different types of blockages. The first blockage is not that severe and it's pretty mild, and that is when you have only one fallopian tube that is blocked. Now, if this is something that you're dealing with, you can fairly easily get treatment and get this corrected. Just depending again on how severe and how progressed those scars, adhesions are, and those blockages are, you could definitely get a treatment, get that cleared up, and work with your doctor to find what fertility medications or what alternative fertility methods you can try that will help to increase your conception odds. And typically when you have one blocked fallopian tube, this really isn't going to decrease or alter your ability to achieve conception or decrease your fertility odds. The second type of blockage is when you have a partially blocked fallopian tube. And what this means is you have one or both of your fallopian tubes that are partially blocked or have scars and adhesions that are partially blocking or preventing the egg from traveling down the fallopian tube or preventing the sperm from traveling up into the fallopian tube to fertilize the egg. And of course, this is going to greatly decrease your fertility chances and your fertility odds. The third and final blockage is when you have fully blocked fallopian tubes. That means there is no chance or no risk of anything getting past that blockage, meaning sperm is not able to travel into the fallopian tube and the egg is unable to travel out of the fallopian tube. So with this, you are definitely going to have and struggle with fertility issues, and this is most likely one of the most common causes and reasons for infertility. Now, unlike many of the other conditions or issues I mentioned in the infertility series, when it comes to blocked fallopian tubes, there are no outward signs and symptoms that will present themselves to alarm you or let you know that you may or may not have an issue with blocked fallopian tubes. In fact, most women that are struggling with infertility will just go to their doctor and begin that normal process of trying to identify as what could be causing their infertility, will then discover through that process that they do indeed have blocked fallopian tubes. So some common tests that are run or administered by your medical professional to determine if blocked fallopian tubes is an issue or a cause for your infertility is going to be the hysterosalpingogram, which is an x-ray that takes a look at your fallopian tubes to see if there are any scars, adhesions, or blockages present. Now, if for whatever reason the hysterosalpingogram is not effective or it's not an option, your doctor may elect or may choose to do a laparoscopy, in which that case a small incision is made on the abdomen and an instrument is inserted into the abdominal cavity where they're going to look at all of the reproductive organs. Are going to assess everything, including the fallopian tubes, to see if there's any scars, adhesions, or blockages present, and they can get a full picture as to what is going on and what is contributing to your infertility. Now, if after you have met with your doctor and you have gone through the testing process and the tests have shown that you do have a blocked fallopian tube, this is going to be the time where your doctor is going to discuss with you what options that you have and your treatment options. So some treatment options that he may suggest and he may talk with you about and recommend if you have minor to moderate scars or adhesions or blockages is that he's going to recommend a laparoscopic surgery, in which again a tiny incision is going to be made on the abdomen. The tool is inserted into that pelvic cavity where they can see all of the reproductive organs and they can treat any of the scars, adhesions, and blockages. Now, if your doctor discovers that there is damage to only part of the fallopian tube, he may recommend that surgery be done to remove the damaged part of the fallopian tube and to connect the two healthy parts of the fallopian tube together. Now, if your doctor discovers that there is severe damage or severe scarring and adhesion present in the fallopian tubes, there may not be a treatment that he can safely administer or safely recommend, but there may be other fertility options or fertility treatments that he may be able to recommend to you, just depending on your current state of health and just again your unique situation. That is all for today's video. I hope that you found this information helpful and insightful. If you did, give me a thumbs up. That just lets me know to continue making more and more of this content. Also, since this is a part of a series, if you want to continue to learn more about infertility and learn more about what it is and educate yourself on some of the different conditions and things and reasons or issues that can contribute to infertility, I encourage you to subscribe to this channel and ring the notification bell so that way you can continue to receive notifications about new videos that I upload here on this channel for the infertility series. So again, that is all for today, and until next time, here is to redefining health and staying forever young. Bye.